Hello, and welcome to the Social Protection Podcast. I'm your host, Cheah. Today, we're talking social protection myths and misperceptions. Does welfare make people lazy and dependent on handouts? Do cash transfers just encourage women to have more children? Is a lot of cash wasted on things like tobacco and televisions, or on people that don't deserve it? We're reviewing the global evidence and asking, why do these perceptions persist? I'm speaking now to Cheah Palermo, who is President at Policy Research Solutions, or PRESTO. Welcome, Cheah.
Thanks, Joe. Good to be here.
And with Rema Hanna, who is at the Harvard Kennedy School and a JPAL affiliate. Welcome, Rema.
Thank you so much. It's so nice to be on the show today.
So before we start, I did want to have a bit of a reality check. We know there are no silver bullets in development or public policy more broadly. What we call myths have to start somewhere. Today we're going to discuss questions that have been the subject of evaluations and study, often in a lot of different places and contexts. And we'll talk about the weight of the evidence that we have. But I think it's fair to say that it's not true that cash transfers never lead to bad outcomes, and quite the reverse is possible. Listeners to this podcast know, of course, that good design is key to achieving positive outcomes and positive effects. So we'll try and talk a bit about what that looks like too. So Cheah, to kick us off, I'm going to begin with perhaps the biggest myth perception that you'll hear from social protection detractors. Social protection ends up making its beneficiaries lazy. They get handouts, which means they don't want to work. They become unproductive and reliant on benefits over time. Cheah, what does the evidence say when we look at that question in different contexts?
Cash transfers don't create a culture of dependency, and they don't make people work less. In fact, the evidence shows that cash transfers enable households to become more productive, diversify their livelihoods, and increase their income. Participants often use cash transfers to make productive investments. This might look like investments in livestock, micro enterprises, and sometimes farm inputs to make their household farm activities more productive. We also see evidence from the Transfer Project in Africa that shows that cash transfers often enable working-age adults to switch from casual day labor or begging to more preferable and productive forms of work. So for listeners who aren't familiar with the Transfer Project, it's a collaborative network between UNICEF, the Food and Agriculture Organization of the UN, University of North Carolina, national governments, and other local researchers, providing rigorous evidence on the effectiveness of large-scale national cash transfer programs in Africa to use this evidence to inform policymaking and programs. Cash transfers can help households diversify their livelihoods, and this often takes the form of micro-enterprise operation. So a multi-country study of qualitative data by Eleanor Fisher and colleagues showed that cash transfers often give women increased choices regarding their livelihoods. And when we look at the evidence among women specifically, another global systematic review and meta-analysis by Amber Peterman and colleagues showed that social safety net programs, which includes cash transfer programs along with other programs, increased women's labor force participation as well as the productive intensity of work. So there are some exceptions where cash transfers have been found to reduce women's work, but this is often found among elderly women. And among elderly women, we often think that reductions in work is not necessarily a bad thing, especially if intensive labor might be bad for their health or overall well-being.
Rema, you're the co-author of one of the definitive works on this subject, The Myth of the Lazy Welfare Recipient. How do you answer this question?
So let me first say, I think this myth has perpetuated. Recently, we did a survey of over 50 high-level current ministers in countries around the world, former ministers, very high-level civil servants. So these are people with real policy decision-making power. And what we found was that many of them did say that cash transfers causes people to work less and tend to not have jobs, to work less hours and such. So the myth persists despite the fact that a lot of the evidence out there, including some of my own work, shows that we don't find an effect, at least at the current levels of money we're giving out in cash transfers in many developing countries today. We don't find an effect of these programs on work behavior. Now, it's kind of interesting. So why does this happen? I blame economists. And I think, the economic theory says very strongly that, you give people cash, they take more leisure, they're going to work less. But I think there's two to three issues around this that we should really be thinking about. First, we should look at the empirical work. And what we find is in most low-income, middle-income countries at the levels of cash transfers we're giving, we're not really finding effects on work. Even in very high-income countries, when we're giving out money, and we do see sometimes effects there on people work a little bit less, the effects are actually quite small in magnitude. And we should be comparing that against the benefits of cash transfers because, and I think for most countries, the benefits outweigh these costs on work. I do think that the last thing we should really be thinking about is that bad? So maybe sometimes people work a little less, they take longer to find a job. So let's take some examples. Suppose you have an unemployment insurance program and you're giving people transfers through the unemployment insurance program and it's taking them longer to find a job. That might actually be good for society because we want people to find the best possible job for them to be productive. Or suppose somebody is really sick. It's not productive for them to be working right now. It might actually make them even unhealthier. It might slow down the process of recovery. We might not want them to work. So there are lots of cases where maybe there is some labor supply effect out there, but maybe that's not necessarily a bad thing either.
Yeah, it's a really great point. And it's a point Cheah made earlier as well. As people are getting older, you'd probably prefer them not to have to be working, for them to be protected. That's kind of the point of many forms of social protection. Is it fair to say that the empirical evidence that you mentioned translates across locations and geographic settings? Is this quite a consistent finding in different places?
Yes, this is a consistent finding. So, for example, in the study that we looked at large-scale experiments where the government had run a large-scale social protection program, a cash transfer program. So it was a real program at a large scale. And there was an experimental evaluation done that was high quality. And so we're able to evaluate the results. And so we had 7 countries in our study. We had countries like Morocco, we had the Philippines, we had Mexico. So we had countries from all over the world. And what we found, for example, was that the men, on average, 85% of them were working. The cash transfers had no effect either on whether or not they worked or the hours of work. And it was pretty consistent across all of the countries, despite the fact that they're different contexts and they're different amounts of money given out. Our study's not the only one. There's a lot more recent evidence out there showing that these programs don't really affect work. The final thing I should say is also it's these intergenerational things. It's investments in education and health of kids. And we are starting to see some really long-run studies right now showing that has effects on work. So, for example, there's a great long-run study of PRESTO showing exactly that, particularly for kids who end up doing very well in life. For kids who start out very poor, PRESTO invests in their education and health. It gets them to a much higher income. And a lot of that is also due to the fact that they have more opportunities, they're able to migrate and such. And so, again, I bring it back to economists. We really did the world a disservice by saying, here's a model showing here's a cash transfer and then it stops people from working. But the theory is actually much more nuanced than that. And the data often tells a different story.
Yeah, I think the cultural memory, at least in developed contexts, from an earlier time when perhaps unemployment benefits, for example, were particularly high at replacement income rates, replacing what you might earn from a job, and where people may have made rational choices about whether taking on low-paying or precarious work was actually worth trading off that secure benefit. Of course, in the low and middle income countries we're talking about, cash transfers are much lower in value. So that leads me to my next question, which is, Cheah, what kind of design choices matter if you're looking to cash transfers to support productive work and the kind of economic empowerment that you've been describing?
So particularly in lower and middle income settings, the ability of cash transfers to really have these effects on productivity often depends on transfer design characteristics such as the transfer size, their predictability, the level of market development, and households' labor capacity, as you mentioned. Cash transfers really need to be both predictable and of an adequate value. And oftentimes this means that the real value of the transfer has to keep pace with inflation. So we often see impacts on a broader range of outcomes, including productive impacts, when cash transfers are at least 20% or more of households' pre-transfer monthly consumption. Transfer amounts that are smaller than that 20% benchmark might be fully consumed in improving households' food security or meeting other basic needs of household members. And that really leaves little left over to facilitate investment in some of the things we talked about. It's also important to remember that transfers targeted to people with disabilities. People with disabilities have a higher cost of daily living. And so transfer values really need to be adjusted accordingly to both enable productive inclusion among people with disabilities, but also if they're expected to have these productive impacts. When we talk about predictability of cash transfers, this is important because if households don't know when the next cash transfer installment is coming, or if it's coming at all, then most likely they're not going to spend that money on larger investments or take more risks. So some of these activities might look like investing in a microenterprise, which can diversify your livelihoods and also increase your income. It might also look like adopting climate-smart agricultural techniques. And both of these activities require more forward-thinking decision-making, which cash transfers can help enable. So as a related point, there's often anticipation on the part of governments that households will be able to receive support, perhaps for a short period like 1 or 2 years, and then they're going to graduate from social protection programs. But this is really inaccurate for a lot of reasons. First, many households helped by cash transfers still might remain in very precarious situations, and a shock like an adverse climate event might set them back. Other households, like the elderly, we talked about how many of these households have limited ability to engage in productive activities, and therefore they're going to need continued support. But more importantly, in the words of the brilliant Fabio Vera Suarez, individuals don't graduate from the need for social protection. Rather, they might graduate into needing other forms of social protection. For example, poor households might graduate from needing social assistance to needing other forms of social protection like social insurance programs. And in fact, when we look at high-income countries, we see more social protection, not less social protection. So I think that's also really important to keep in mind.
Yeah, it's really interesting to introduce the notion of graduation, maybe not as a myth, but not as straightforward as it often seems on paper. But coming to the next myth that we wanted to explore, which I think is often quite linked, not only are welfare recipients considered lazy, but they also exhibit poor judgment. If you give people cash, they're likely to waste it on things like alcohol, tobacco, gambling, consumer goods, that kind of thing. Rema, coming back to you, what does the evidence say in this case?
This is, again, the myth persists. And again, going back, we did this high-level survey of policy decision makers, like very, very high level in many countries. And we saw this as well, that they thought cash transfers, people would spend it on the alcohol and the drugs and such, despite the fact that there's a whole body of evidence out there. This great summary work by Dave Evans really just showing that we're not necessarily seeing that. But for me, it also goes back to sort of these philosophical things as well. The whole point of cash transfers is you give people choice about how to spend their money. And maybe you see a little bit of people, buying a little bit more consumer goods. Is that necessarily a bad thing? I don't know. But for the most part, we're seeing people make investments in their kids. We're seeing people make investments in their business. We're seeing people buy food. But they're also making decisions that are right for them.
So, obviously cash transfers tend to be designed for certain purposes, or at least they're conceptualized that way, and they tend to be funded on the expectation that it will be supporting kids to be in school or nutritional outcomes or whatever it is. What does the evidence say about how you can sort of nudge people towards those outcomes?
So I think this is a good point. I think a lot of these programs are marketed as programs that are top-ups for the family, where it's really about helping to provide a little extra help for your kids, making sure they get enough nutrition and such. And in fact, that's what we actually see out there. There's been these nice studies where they give some people cash transfers, and then they do an RCT where they get randomized and give some people cash transfers and other people a labeled cash transfer where they say it's for education, health, and such. And they see the labeling often works and nudges people some more. But even with just pure cash transfers, you see people making these investments because for many people, they want good things for their family. They want good things for their kids. They do want to invest in them. And so we're, even without these nudges, we're often seeing people making these kind of investments.
So, Cheah, just to follow up with a couple of questions about what happens to people when they receive cash transfers. One really common design feature is that household or family cash transfers are often provided to the women in the household, the mother in the household, rather than men. Partly, I think, because there is this perception that men are more likely to indulge in those vice activities and goods. Do those assumptions hold? And what are the consequences, both positive and negative, of this common practice of making women in the household recipients of cash?
Cash transfers really can improve the well-being of families, including children, whether the benefits are received by men or women. That being said, designating women to receive cash transfers can result in additional benefits related to improving gender equality and women's empowerment. Women are often the designated recipients because they're believed to spend money on things that will more positively benefit children and families as compared to when money is directed to men. We saw this a lot in first-generation cash transfer programs in Latin America and the Caribbean in the late 1990s and the early 2000s. So these cash transfers were most often conditional on children's school attendance and health checkups. However, the responsibility for complying with these conditions most often fell to women. And critics like Maxine Molyneux, among others, argued that these conditions both reinforced gender stereotypes around caregiving and also increased women's unpaid care work and their time poverty. So, in contrast, women can be designated as recipients rather for the intrinsic value of addressing inequities that women face, often in access to resources. Cash transfers improve women's bargaining power in the household. It also improves women's ties within the community. It often allows them to reintegrate into the community and social networks in a variety of ways. So these all in turn have positive impacts both on productive inclusion, but also gender equality more broadly.
At least partially linked to the idea that people might buy alcohol or gamble with cash transfers is the risk perhaps of increased violence towards women and children. And then sort of separately to that, there are studies that show that increased economic empowerment, for example, through work, as women have more independent sources of income, can result in a change in household dynamics, and that can translate into violence. What do we know about the correlation between social protection and gender-based violence specifically?
First, to your point about employment and the risk of violence against women, some new work we're conducting in the Cash Transfer and Intimate Partner Violence Collaborative is showing pretty mixed evidence on the effects of employment, whether it's women's employment or men's employment, on intimate partner violence risk. However, we do see that male unemployment consistently increases intimate partner violence. Turning back to your question, there is very strong evidence that cash transfers reduce intimate partner violence. They do so through various pathways. This includes reducing poverty-related stress and improving emotional well-being of household members, reducing conflict over daily needs, increases in women's agency. So this evidence all contrasts with the often repeated concern that when women are designated as cash transfer recipients, this will cause a backlash from their male partners as men try to reassert their authority or gain access to cash. There have been 2 global reviews which have aggregated data from a lot of studies from lower and middle income countries, and both of these concluded that cash transfers reduced intimate partner violence. In fact, reductions in intimate partner violence caused by cash transfers from one of the reviews ranged from 11 to 66% reductions. Effects were particularly salient for reductions in physical and or sexual intimate partner violence. Across both of these reviews,
earlier you talked about the generation of cash transfers that were conditional on things like children's attendance at school, mothers attending health clinics with their babies. That was compulsory, monitored, and beneficiaries could even be penalised or docked if conditions weren't met. But, some might say, well, if people aren't required to go to the clinic, they simply won't go. Do cash transfers need to have conditions attached to be effective or to have those desired outcomes?
Conditional cash transfers do not always have larger impacts than unconditional cash transfers. And in fact, the evidence shows on a lot of outcomes, such as impacts on women's mental health, women's economic achievement and agency, are often larger. Conditions can also have the negative unintended consequence of further marginalizing the most marginalized households, so those without access to services or the largest barriers to school attendance. There have been systematic reviews that have aggregated evidence across many countries, also largely focused in lower and middle income settings, that have looked at schooling, mental health, women's agency, and economic achievement. So one of these reviews, conducted by Baird and colleagues, showed that both conditional and unconditional cash transfers increased school enrollment and school attendance. The difference in impacts between conditional and unconditional cash transfer programs on enrollment was not statistically significant. And what this means is that we cannot conclude that there are meaningful differences in impacts between conditional and unconditional cash transfers on school enrollment. And finally, the review by Amber Peterman and colleagues that looked at social safety nets, including cash transfers in lower and middle income countries. This review aggregated data from over 100 studies and found that these social safety net programs had positive impacts on women's economic achievement and agency. However, conditional cash transfers had smaller effects than unconditional cash transfer programs on these outcomes. It's important to note that few of the programs included in these reviews that I've talked about randomized whether conditions were imposed or not. So these conclusions across studies might also be capturing contextual differences. So for example, conditions are more common in Latin American programs, for example, than African programs. And so this could influence some of the outcomes of interest. I think a lot of this evidence really underscores that people spend cash transfers wisely. So it's really condescending to think that poor people don't know what's best for them. Cash transfers have been found over and over to be cost effective. And I think this is really important in the current environment where leading donors are reducing their official development assistance. And we really have to be thinking about how to make the best use of the remaining available resources.
Thank you. I think it is really interesting, isn't it, that some of the kind of earliest and studied cash transfers were the Latin American conditional cash transfers. And I think for a long time, there was this assumption that, impacts we're getting from cash transfers are because they are conditional cash transfers. And once people started to look at unconditional or labelled cash transfers, that's where there might be a good communications campaign about the intention of what the cash should be used for without necessarily imposing that kind of monitoring. But when I talk to my Brazilian colleagues about Bolsa Familia, for example, they'll talk about conditions as actually being intended at least to trigger follow-up, understood to be more around case management. If somebody can't get to school, the question is why, and then how could those people be supported? But certainly when I was working on CCTs in Indonesia 10 years ago, the local capacity around that kind of monitoring support wasn't there, and the condition had been really translated into much more kind of letter of the law, are kids there or not, without that backup. Another really persistent issue and concern, obviously, with all forms of welfare and social protection cash transfers is fraud. There is this perception that it's easy for people who are not deserving to claim benefits, rort the system. Really interested in how this is kind of tackled in the literature. So, Rema, what does the evidence say about fraud?
That's a very big question. I guess the first thing I would say is that fraud does exist. We can't pretend it doesn't. And it exists to different degrees, depending on program design. And we could talk about that more in the moment. And I don't think you're going to be able to get it exactly down to zero, because the way to get it down to zero is very easy. You just don't have a program, or you have a program so difficult that nobody can access it. And so at the end of the day, you want to have some balance. You want to be able to have a program that's easy for beneficiaries to access, especially in developing countries where there might be challenges with literacy. There might be a fear and vulnerability about interaction with the state. There might be challenges in terms of being banked in the formal banking system. But what you want to do is try to minimize fraud, and you want to get it to the right people. And that's where having careful program designs matter as well. So for example, I can explain one of the studies we worked in Indonesia. There was a transfer program that provided poor households with a certain amount of free rice each month. And what we found for many years in the data, that a lot of households that were eligible for these programs that really relied on this food for a subsistence didn't get the full amount that they were supposed to get. They only got about a third of what they were supposed to get. And some of this is because some rice went missing, but it also went to households that were not necessarily eligible for the rice transfers. And so the government of Indonesia some years ago did this very large reform where they decided to move from these in-kind transfers that gave people free rice to a physical debit card. And what we found was super fascinating. In fact, it was actually cheaper administratively to run. But this just switching the type of transfer people got really reduced access for people who weren't eligible for the program. And it increased the amount that poorer households were receiving each month and actually reduced poverty. And here it's where I think there's going to be a lot of both interesting opportunities, but also challenges as we start thinking about other types of new technology and stuff to make transfers more efficient. There's a lot of moves away from just giving cash at the post office to banking systems. And we think that through bank accounts can make things more efficient and get it to the right person, and banks can verify. There's been a lot of talk about mobile money, but we're also seeing that with less checks on the mobile money, you're also seeing a lot more fraud there. And so thinking about how to make mobile money accounts more secure, I think, is going to be something that can increase ease, but also, try to solve the fraud issue.
Yeah, thanks, Rema. I think a related issue here, perhaps I could put it in terms of the myth of perfect targeting, because when we're talking about who's deserving and who's not and who's therefore committing fraud, you are, conceptually thinking about a perfect list of people who are entirely eligible. But we do know that poverty targeting is imprecise, let's say, and even sort of simple or categorical forms of targeting, for example, trying to reach children under a certain age, you're still going to run into all of those issues around who's got birth certificates and how you're sort of representing people. So this ideal that we're striving for is also in itself a bit of a myth.
I think this is why more research is actually needed. In the example I just gave of moving from the in-kind transfers to the debit cards, we actually looked at the consumption levels of people and we looked at poverty rates. And what we found was that there was actually, by getting it targeted to the right people, of course there's errors. We're going to miss people. People who shouldn't get it are going to get it. The system's never going to be perfect. But this was actually a course correction in making sure more people who were very low income were receiving it and actually reducing poverty rates. But in other programs, that's not the case. So for example, I've done a bunch of work on community targeting because of this idea that maybe communities have more information and can do this reallocation better. And it was really interesting there because I must say, I really thought, oh my God, there's going to be so much corruption, so much elite capture. And this is where the research really opened my mind and changed the way I saw these things, because what we found was that there was actually less elite capture than you thought. The communities were actually trying to give it to people who were vulnerable, but on different characteristics. And in fact, when you found elite capture, it was kind of the elites were giving it to relatives of theirs who were relatively poor off. So it's not clear that they shouldn't have qualified anyway. And in fact, actually, we did these simulations that if you corrected the corruption, it wouldn't have affected things as much as if you actually just collected better data on targeting. like improving the data quality and the targeting mattered more than some of these aspects around corruption. I do think fraud prevention is important. I do think we want to balance it with flexibility. And, I don't love the idea as fraud as an outcome that we want to just obsess about. I want to obsess about the people who are really in need getting it. And that's going to minimize fraud, but also make sure that the people in need actually get it.
The next myth we wanted to unpack today is around fertility and children. Women will have more babies, especially if those cash transfers are targeted or focused on children. Cheah, what does the evidence say?
Cash transfers do not increase fertility in lower and middle income settings. And in fact, cash transfers can reduce adolescent pregnancy and increase birth spacing, particularly in Africa. And this includes child grants. So a common concern among policymakers is that cash transfers targeted to families with young children might lead those families to increase the number of pregnancies or additional births. And the thinking is that families might have additional children to try to maintain their eligibility for benefits. But what the evidence does show is that cash transfers generally either have no effect on fertility or they reduce the likelihood of pregnancy or giving birth in lower and middle income settings. Large national cash transfer programs in both Brazil and South Africa, for example, reduced adolescent childbearing. And in South Africa, the child support grant also increased birth spacing. And this increased birth spacing improves the health of both the mother and the newborn. In high-income countries, the pathways between cash transfers and fertility might work differently, largely because conditions such as fertility rates are different. So policymakers in high-income countries often have the opposite concern, where birth rates are often low, oftentimes below replacement level, and so they want to incentivize more births. So Dr. Karen Guzzo of the University of North Carolina recently discussed this topic in an interview on National Public Radio in the US. And she concluded that cash incentives tied to having children, by and large, do not have any substantial impact on birth rates overall. And this is at least in part due to the very high costs of having children and the relatively small amounts of these cash incentives in comparison. What cash incentives sometimes do is change the timing of births. For example, you might decide to have a second child a little bit sooner, but you're not going to decide to have more children overall. What some researchers have concluded is more likely to change decisions around fertility is a combination of both robust social protection schemes combined with gender equality.
And I guess to your earlier point, there are cash transfers and then there are other forms of social protection like paid parental leave or maternity insurance or some of these things that probably do support more women to have more children if that's actually what they want. So what design features matter in this context?
So generally, again, the evidence does not suggest that we need to worry that cash transfers will increase fertility. That being said, there are some program design considerations that can assuage fears around fertility increases. Eligibility criteria can be carefully designed such that the transfer amounts are capped to a maximum number of children per household. Program duration can also be extended according to the eligibility age of children. So, for example, children can continue to be eligible until older ages. And this can reduce the perceived risk of incentivizing childbearing to maintain eligibility.
So let me come to the final question. A lot of this evidence that we've been talking about has been around for a long time. These are studies going back decades. We continue to find similar findings in new studies. And yet, as Rema said at the top, policymakers still worry about welfare, making people lazy or people wasting money and so on. So what is it? Why do these attitudes persist? Do we just get rid of all the economists and maybe take it from there?
Well, I wouldn't get rid of all the economists. No, this is a question that unfortunately is not just about social protection, but about our political system in general right now. It's very easy to ignore the evidence or to not trust it, especially if you're not sure about how the evidence was actually made. There's a lot of distrust around experts right now, and maybe some of that is our own fault for not communicating well. I do think there is also the challenge of, particularly with a lot of these social media out there, to focus on one particular case. We found one person who committed fraud, or one case of corruption, or one person for whom this didn't work. But it's that one case doesn't necessarily negate all the other benefits. And I think it means that we need to be really thinking about how do we change the way we communicate given this new media. It's easy to say people are getting it wrong, but the truth is I think it's more we should be reevaluating ourselves and how we're communicating the evidence, because nothing's going to change unless we do that.
Cheah, what do you think?
That's a really good question, a tough question to answer. I think in part, we as researchers don't always do a good job of communicating what evidence is out there. So I want to start by thanking you for what you do on this podcast, which is make evidence accessible, and you facilitate conversations around really important topics in social protection. A lot of the time, the rigorous evidence we have is in academic journals. Researchers are often hesitant to make broad sweeping statements, and that's because the answer often depends on a lot of factors and context. And policymakers really want conclusive, definitive answers. But that's also not the full story. As we know, policymaking is not linear. It doesn't always start with a question and then lead to evidence answering the question and uptake of that evidence in policymaking. Oftentimes, innovation in policymaking happens during what are sometimes called policy windows, which are opportune moments when several factors align to enable opportunity for action and a policy to be passed. These windows often follow either shifts in public opinion or changes in administration. It often requires a champion in government who advocates for a program like cash transfers. The reality is that administrations and personnel often change, and there's a need to educate newcomers on old evidence. As researchers, we're often incentivized to move on to the next big thing. So regurgitating the same old evidence doesn't really advance researchers in their careers, but it probably would be really helpful in increasing the impact of research.
Yeah, to build on both of those points, I often think about the high standards expected of spending public money. You know, there's that sense of it's taxpayer dollars that are going into welfare, and that the idea that there's even a small number of people who are cheating in any ways is politically quite risky. And even if the costs of monitoring compliance or guarding against fraud are high, it's like they're the price governments almost have to pay to guard against reputational risk and maybe maintain public support and confidence for the system as a whole.
It's also really, there's a lot of bias and inequity in where we really focus these efforts of rooting out fraud. You know, there's so much focus on how people are using funds at very low ends of the income and socioeconomic spectrum, very small cash benefits. For example, in the US, there's a lot of scrutiny over how people are using temporary aid to needy families or other benefits. We call them SNAP, to increase food security. And yet there's very little scrutiny of subsidies to corporations, or even if you look at the COVID-19, you know, there was tax credits to families which halved child poverty in our country, which was wildly successful. We let those expire. Child poverty rates went back up. But there were also much larger loans which were then forgiven. So people at higher ends of the income spectrum that owned businesses and were arguably much better off to begin with. And there was almost no scrutiny of how people were using that money and whether those people were deserving of the money. So I do think there's a lot of bias in who we scrutinize, and that also should be looked at.
Yeah, absolutely. And of course, you know, if you look at who is most likely to be poor in any given society, there's a lot of overlap with who are going to be the most marginalised groups. Rema, Hanna, Cheah, Palermo, thank you so much for taking the time to join us on the Social Protection podcast today.
No, thank you so much for having me.
Thank you, Jo. It was great to be here.
At this point in our show, we normally bring you some recommendations, events or publications that have sparked our interest and that we think you should know more about. But this month, instead of those quick wins, we've recorded a short bonus episode on social protection in Gaza and the occupied Palestinian territories. So watch out for that in your feeds in the next few days. That's a really fascinating and important conversation. In the meantime, let me just mention 2 recent publications from our guests for this episode. Cheah Palermo is co-author on a short paper titled Evidence Brief, Dispelling Myths on Gender and Cash Transfers in Africa, released earlier this year from the Transfer Project, and the paper that Rema mentioned, which surveyed high-level policymakers on their attitudes and beliefs around social protection, has also just been published as a working paper. Look for Social Protection Policymaker Beliefs and Empirical Evidence, co-authored with Ben Alkin and Alex Weiss. It not only presents the results of those surveys, which are interesting in their own right, but also, much like this episode, surveys the literature to judge whether those beliefs are supported by evidence or not, as the case may be. We'll also attach a long list of references supporting the points made in this episode in the show notes, a wealth of information for all you mythbusters out there, and with special thanks to Cheah for providing us with that really comprehensive list. Thank you for joining me on the Social Protection Podcast, brought to you by socialprotection.org. You can find all of our episodes on the socialprotection.org website and on your favourite podcast platforms. Be sure to like, subscribe, and leave a review. Back next month. See you then.